Even as states across the country are currently grappling with COVID beds, Tamil Nadu government has made changes to its admission protocol to ensure that there is no scrambling for the limited beds that are currently available in the state. Under this new rule, all positive patients are screened, following which the authorities take a call on whether the patient actually needs to be hospitalized or not, COVID care facility, or needs to be put, whether he actually needs a COVID care facility but not a hospital per se, or can the person simply be put under home isolation. So this is the decision that is taken by the government of the day, by the authorities, by appointed authorities, who will decide whether hospitalization is even necessary for a particular COVID positive patient. Chennai civic body has set up 12 such screening camps across 15 zones. The move comes after Tamil Nadu's active caseload breached 1 lakh mark. Mirror now spoke to Tamil Nadu Health Secretary on how the state is currently dealing with this crisis.
State is in the similar kind of situation, and we cannot simply say that we are doing better. So this is a stage where we have very judiciously triaged patients to come to this. Today you are seeing a screening center where the moment somebody is positive, we provide vehicles and bring them to screening center, do a X-ray and a complete blood count. Those who are under simultaneously also check their oxygen. If they are very low, we don't do anything, directly shift them to hospital. Otherwise, here we triage them, and who is supposed to go to hospital, we send to hospital. Who is supposed to go to a COVID health center, we send to a COVID center. And who is supposed to stay at a COVID care center if he doesn't have facility, or if he has facility, a separate toilet and a separate room, we put them into the COVID home quarantine, which is also critically monitored.
Sir, how many are we in the process of increasing the bed capacity in the state of Tamil Nadu, sir, because the numbers are increasing?
We have around 34,000 oxygen beds and overall around 1 lakh beds. But we are augmenting oxygen bed by another 12,000. If you look at daily, we are also not decreasing. Somewhere the growth rate has slightly come down, but it is too early for us to draw a conclusion that it is going to stabilize or plateau and all. And we don't know, because we look at a consolidated state picture, there will be individual variation. Like 6 to 7 districts contribute 50% of the cases. So we are working very closely and monitoring, but we are adding 12,000 oxygen beds, of which around 2,000 will be by this weekend, and the next thing will be over a period of next 15 days.
Starting this COVID second wave in many states, people are still finding hard time to find a bed in hospitals. But here in Tamil Nadu, the Tamil Nadu Health Department still manages to accommodate everyone who comes forward to get hospitalized for their COVID treatment. Now we are here in a screening center in Tandayarpet. There are 12 such screening centers which are being run by the Chennai Corporation. So now, as the numbers are going up, the health department have made a change to their admission protocol. So if a patient tests positive, he has to come to one screening center like this here, and after coming here, he will be assessed by a doctor here. That is, he will be subjected to several tests, which includes an X-ray also. So after an assessment, if a patient requires critical care, he will be sent to a major hospital. That is, Chennai has 5 major hospitals with all the necessary treatment equipments and facilities. So if a patient requires critical treatment, he will be sent there, or if a patient just needs isolation, he will be sent to COVID care centers or home isolation. Or if a patient requires oxygen support or a minimum of health care, he will be sent to COVID health care. And this is how Tamil Nadu manages to accommodate everyone who come for treatment. And with more than 11,000 beds available here in Chennai, now the health department have planned to augment more than 12,000 beds in the coming days, and at least 2,000 beds will be coming to use in this week, is what we are getting to hear from the health department secretary Radhakrishnan. With video journalist Vijay Mugilan for Mirror Now from Tandayarpet Screening Center.